Hi, I'm Billie Roberts, a senior student majoring in exercise physiology at Midwestern State University.
Hi, I'm Lydia Acuna. I'm also a senior at Midwestern State University studying exercise physiology. This project was overseen by Dr. Choi. She is in the Department of Athletic Training and Exercise Physiology.
First of all, we wanted to start off by thanking the organization to allow us to have the opportunity to present our research. We decided to do our research critique on the article, Effects of Home Confinement Due to COVID-19 Pandemic on Eccentric Hamstring Muscle Strength in Football Players by Marina Perez and other authors. This was published in the Scandinavian Journal of Sports Medicine. Due to the onset of the global COVID-19 pandemic, a large population around the world has been subjected to long periods of quarantine. Among those who participated in these periods of quarantine are the athletes. This quarantine affected the athletes by making it particularly difficult for them to maintain their fitness and skill levels that they needed for their sport. This is mainly due to the lack of space and equipment within their quarantining quarters. There has been evidence that detraining occurred even among the athletes who participated in physical activities to maintain fitness status. This detraining caused an increase in negative effects in athletes returning to sport. There are many effects of detraining on athletes. Some of them include increases in body fat percentage and decrease in VO2 max. However, many of the effects of detraining on athletes happens within the muscle. Some of these effects are decreased power performance, decreased strength performance, decreased flexibility, and decreased area of fast twitch muscle fibers. A gap in the knowledge exists within the known physical effects of quarantine on muscle strength in athletes. There has been evidence that detraining during quarantine causes an increase in muscle injury. However, the research of why these injuries are occurring are minimal. Due to an increase in muscle injuries when returning to sport, there has been an accumulation of inquiry about whether athletes should be allotted a time for retraining prior to returning to their sport. The purpose of this article was to explore the effects of quarantine on eccentric hamstring muscle strength in football players. The participants of this study were 30 football players who all participated on the same team in the Spanish Soccer League prior to the pandemic. All players were male. The methods of this study consisted of the players participating in a 7-week quarantine, during which they would do exercises to maintain lower extremity muscle strength. In order to measure and evaluate muscle strength in the players, they would use a Nordic hamstring test, along with what was claimed to be a reliable and video-based method. This exercise test was measured on the 14th, 28th, and 49th days of quarantine. Each day of testing was performed after a rest day and at the same time of day each time.
These were the results that were the outcome from the study. So as you can see, there's a general trend of decrease. So in the first graph, we can see how there's a decrease in the Nordic breakpoint. At 28 days, there was a 1.9% decrease, and at 49 days, there was a 4.4% decrease. And the second graph is the hamstring muscle strength. At 28 days, there was a 8% decrease in muscle strength, and at 49 days, there was a 14.1% decrease. The authors concluded that there was eccentric hamstring muscle weakness, and they expected this to be present in other muscle groups in relation to confinement from COVID quarantine. With this, they expected that there would be higher risk for injury. Therefore, they requested that a retraining period be allotted to these athletes in order for them to regain their baseline strength. This because during quarantine, they could not do the exercises on field that they could only do in confinement. Next, we will do the critique on the study. These were some of the strengths that we saw in the study. First, little research studied the correlation between the confinement during the pandemic and strength of the muscles. Therefore, this was one of the first studies to address this topic. Additionally, the test measure used, the Nordic hamstring test, is reliable. Therefore, we can conclude that the results were trustworthy and reliable. Additionally, this study supplied guidelines to potentially lessen injuries on return to play. And lastly, this study provided groundwork for future longitudinal research. Therefore, if researchers decided to revisit this topic at a later point, they can use this article as baseline. These were some of the things that were weaknesses that we thought could have been improved. Firstly, the sample taken. The sample was only males, and it was a size of 30 people. Therefore, it was not a very diverse sample, and it's a sample that is not representative of a large population. Additionally, it was never mentioned if the players were at any point affected by COVID, which could have had implications for the test results seen. And it had never mentioned if the players had had previous injuries with their hamstring. Therefore, we suggest that for later research, a bigger sample and more diverse sample be taken. Additionally, the training regimen was not specified. Therefore, one cannot know what exercises they were doing. And even with the sample, we could see that the players were only from one team. Therefore, we cannot conclude if the results that we're seeing were specific to that team or if it was a general trend among all teams. Additionally, there was little explanation mechanisms of injury from hamstring weakness. Therefore, we cannot assume that due to weakness, there will be an injury because the authors did not necessarily explain that correlation. Lastly, once they were reaching their conclusions, they generalized them without evidence for other muscle groups, which we saw in their conclusion that they expected to have that general weakness in other muscle groups, but no tests were done. So therefore, maybe the muscle weakness was only seen because of the ground and because they explained how one of the potential things for decreasing strength was that you could not do, for an example, the turf exercises. So we cannot assume the same thing for upper muscle groups. Overall, we concluded that the study was groundbreaking in a lot of ways, yet there are some things that could be better for potential future studies. These are our references. Please let us know if you have any questions, and thank you so much for this opportunity.